Hello everyone. Today we're diving into the world of a truly fascinating and honestly everywhere infection. Let's talk about toxoplasmosis. It sounds a bit intimidating, but the story is much more nuanced. So, let's figure out what this creature is, whether we should be scared, and if so, who exactly needs to worry. So, what is it? Toxoplasmosis is an infectious disease caused by a specific parasite. Its name is Toxoplasma gondii. It's not a virus or a bacteria. It's a protozoan, a single-celled parasite. And it is incredibly common. By various estimates, it has infected over 3.5 billion people worldwide. That's a colossal number, right? But don't panic just yet. For the vast majority of these people, the infection is completely silent, and they never even suspect they are hosting this tiny tenant. Now, here is the most interesting and crucial part of this parasite's life cycle. Its definitive hosts, where it prefers to live and reproduce, are cats. We all love them, those fluffy bundles of joy. But it is inside a cat's body that Toxoplasma completes its full reproductive cycle. The parasite's eggs, called oocysts, are shed in the cat's feces. They are microscopic and incredibly hardy. In the environment, in soil or sand, they can remain infectious for many months, even over a year. So, how do people get infected? Most often it's through the mouth. Yes, the simple act of not washing your hands. Imagine this. You are cleaning the litter box, gardening in your yard where a neighborhood cat might have roamed, or you just petted a stray cat, and then you touch your face or eat food with your hands. That's it. The parasite can find its way into your system. The second common route is food. Eating undercooked or raw meat, especially pork, lamb, or venison. In the muscle tissue of animals, there can be dormant cysts of Toxoplasma. If the meat isn't cooked thoroughly, these cysts wake up and start their activity inside a human. And of course, always wash your vegetables, fruits, and herbs. They can also have traces of soil, and in that soil, you guessed it, those oocysts from cats might be lurking. What happens inside our bodies? Once inside a human, the parasite starts to multiply. This initial acute phase for some people, especially those with a strong and robust immune system, can pass without any symptoms at all. You might feel a slight headache, a bit tired, and that's it. But sometimes symptoms do appear. They often feel a lot like a common cold or a mild flu. You might run a fever, usually not very high, maybe around 99 to 100.4 degrees Fahrenheit. You can feel weak, have muscle and joint aches, and your lymph nodes might swell up, often in your neck. This can last from a few days to a few weeks. Eventually, a healthy immune system wins. The parasite stops actively multiplying and forms dormant cysts, which can sleep in your tissues for decades, causing no trouble. You become a carrier, and that's perfectly fine for most. So where's the danger? The danger appears in two specific situations. The first and most critical one is pregnancy. If a woman gets infected with toxoplasmosis for the first time during her pregnancy, the parasite can cross the placenta and reach the unborn baby. This is called congenital toxoplasmosis. And this is genuinely dangerous. The consequences for the baby can be severe. Damage to the brain, eyes, and nervous system, which can lead to vision problems, hearing loss, and developmental delays later in life. It's very important to know, if you were infected with toxoplasmosis before pregnancy, at least 3 to 6 months prior, your immune system has already built up protective antibodies, and the risk to your future baby is virtually zero. The primary danger is a first-time infection while you are pregnant. The second situation involves people with severely weakened immune systems. For example, patients with HIV/AIDS, people undergoing chemotherapy, organ transplant recipients, or those on strong immunosuppressive drugs. Their defenseless bodies cannot control the parasite. The infection can reactivate and cause devastating damage. Encephalitis, brain inflammation, myocarditis, heart inflammation, and serious issues with the lungs and eyes. For these individuals, toxoplasmosis is a real, life-threatening condition. How do you know if you've had it? There is a specific blood test for that. It doesn't look for the parasite itself but for antibodies to it, immunoglobulins G and M. If your blood test shows only IgG antibodies, it means you were infected in the past, you fought it off, and now you have lasting immunity. If IgM antibodies are found, it's a sign of a fresh, active infection. If you have no antibodies at all, it means you've never been infected and have no protection. This last scenario, a pregnant woman with no antibodies, is the one that calls for maximum caution. Is there a treatment? Yes, but not everyone needs it. Healthy people with normal immunity and no symptoms do not require treatment. Their bodies handle it. Medication is necessary in the two situations we described. For pregnant women with a primary infection, to lower the risk of passing it to the baby, and for people with immunodeficiencies. This involves specific antiparasitic drugs prescribed only by a doctor. Self-treatment is not an option here. So, what should we be cautious about? Let's summarize in simple terms. If you are not pregnant and do not have a compromised immune system, toxoplasmosis is more of an interesting medical fact than a real threat to you. You've probably already had it without noticing. But if you are in a risk group, here are a few simple rules to minimize the danger. First and foremost, hygiene. Wash your hands, always after any contact with soil, sand, after cleaning a cat's litter box, after coming home from outside. Second, if you have a cat and you are in a risk group, delegate litter box duty to someone else. If that's not possible, always wear gloves and wash your hands thoroughly immediately after. Feed your cat commercial cat food or well-cooked meat, and keep it indoors to prevent it from hunting mice and birds, the primary carriers. Third, food. Meat must be well-cooked. Say no to rare steaks, carpaccio, or raw meat dishes during pregnancy. Tasting raw minced meat for seasoning is also a bad habit to break. Fourth, wash all vegetables, fruits, and herbs that may have had contact with soil thoroughly. And finally, a very important point. Do not panic and absolutely do not get rid of your beloved pet. The mere presence of a cat in your home does not equal infection. If you follow these simple rules, your furry friend will remain a source of joy and comfort, not anxiety. Toxoplasmosis is not a myth, it's a real infection. But its danger is greatly exaggerated for most of us. The key is to be informed, understand the risks, and know the simple precautions. Then, everything will be just stay healthy, take care of yourself and your loved ones, and if you found this video interesting, please like it, subscribe to the channel, and click on the bell to avoid missing the next video.